Good afternoon, everybody. Welcome to today's webinar. I think we'll get started straight away just because it has hit past. We usually have a few people join as soon as they see the webinar started. But I think the introduction kind of, people shouldn't miss anything. So my name is Nathan. I'm the training specialist lead at Ardens. We are looking at the vaccination solutions that we've built for COVID and RSV. So just the resources that we have built within Ardens. And this is obviously for SystmOne practices. I'm sure you all know that because you wouldn't be on it otherwise. There is the EMIS one tomorrow, but I like to say at the start, just in case we've got one person sat here expecting to see EMIS, yours is tomorrow. But yes, we're looking at it for SystmOne practices. And just to say that obviously I am presenting today, but I do have some colleagues on the call. So we've got I'll just do it quickly. So we've got Nicola, James, Hannah, and Tudor. So they are manning the Q&A. So they'll be answering any queries. I don't tend to look at that. I just kind of do the presenting. Otherwise, I was just saying to the other guys, I do get distracted. So they will be answering any questions in there. So they are with me on the call as well. So yeah, I think we'll just get going. So with that in mind, then just kind of a bit of kind of housekeeping before we go any further. So I imagine a lot of you have kind of done these webinars already, so you're probably used to the format, but I'd like to just kind of reiterate it. Your microphones are disabled, so obviously we can't hear you, and obviously your cameras and stuff. It's kind of done on purpose, you're all from different practices and stuff, so this is very much like an overview to kind of go through those resources. You should be able to hear me all right, but obviously, any problems, just do kind of like, just turn your Teams off and back on again, basically. This is going to be recorded as well. So if you do miss a bit or you have to leave or whatever, we will email out the recording to you. So please don't worry about missing anything, or you don't have to write copious amounts of notes or anything. You can always watch this back. And like I said already, the Q&A. So if you do have questions or you're not sure about anything, click on the Q&A button at the top and you click Q&A, you can post your questions in there, and the colleagues that I've already introduced, they will be answering them in there. We'll also provide some links and things to support articles and that in there as well, and email addresses. I'll talk about booking training at the end as well, so you'll have a nice link to a lot of the resources I'll put up on the screen, like a QR code. So yeah, please don't worry about kind of we'll provide you with all these things, but say if you're used to our webinars, you'll know that anyway. And I'm looking at about an hour for this. Hopefully, might wrap up quicker. We'll see, but yeah, we'll go from there. So yeah, that's your housekeeping. But yeah, use Q&A if you want to ask any questions. So what are we actually covering today? So to be honest, it'd be similar to previous webinars, especially with regards to like the vaccination kind of resources that we do. Obviously, we've just updated them. Now, what I'll first do is just do a quick overview of what the vaccination schedules are, the RSV and the COVID. And then kind of look at the solutions that we've provided for you. The majority of this webinar is going to be me doing a live demonstration in SystmOne. I do have some slides with screenshots that we will email out to you as well as part of the video. So you'll have screenshots, but a lot of this is just using it in SystmOne. So a lot of this will be there. So don't worry, I'm not going to be spending the whole kind of webinar on slides or anything. Those of you that might have done the LTC kind of overview ones, we stayed in the slide deck for that. But for this one, we'll be actually, looking at the resources. So yeah, we'll look at live demonstration, and then kind of at the end, I'll just provide some useful links, like I said, to kind of your training and support. So you can, if you need to book training or you want further resources, that will all be made available to you. So the vaccination schedule. So what we're looking at. So we've built resources for RSV and COVID. Now they've already been in there in Ardens. We've obviously just updated them for the kind of the new kind of schedules and things. But it's always nice just to take a step back and just talk about what exactly, what is it that's changed? How is this different to previous years? Now, the first thing is RSV. So I'll do RSV first, and I'll kind of go through those resources. Then I'll do COVID. To be honest, once you get onto COVID, you'll be like, well, it kind of works the same as that. And you'll see the new template we've built as well. So I'll do that. But the schedule, so RSV, so from the 1st of April 2026, essentially the change here is there's kind of no upper limit. So I think previously, I think it was up to 80 years old that you could give it. Well, now that cap has kind of gone, and it's basically from the 1st of April, anyone over the age of 75 can have the RSV vaccination. It's also now including residents in a care home as well. So anyone in care home for older adults, they are now eligible for RSV. And kept the same as pregnant women from 28 weeks gestation. So that's important to know about that 28 weeks. A lot of you probably know this already. You've been doing RSV for a while. That's not changed. It's really that kind of upper limit that's kind of been removed. And I'll show you on the templates around kind of the pregnant women as well about coding that and things. But essentially, every time someone's pregnant, they can have the RSV vaccine. So it's not something, that we've had that kind of question before as well. But yeah, so that's what's changed with the RSVs. Not massive changes, but it's more that upper limit. So we've changed the reports to reflect this, and obviously the template. Then moving on to COVID. So from the 13th of April, that's the date you can start doing this. I don't think COVID's changed at all, to be honest. It's kind of very familiar now, but obviously it's just that 13th of April date. So it's anyone over 75, including those who will be 75 by the 30th of June 2026. Again, those residents in care homes for older adults, and then the individuals aged 6 months and over who are immunosuppressed. So again, I think it's pretty much the same as previous years or before, but your spring boosters start from the 13th of April. So again, our resources have just been tweaked and updated to reflect this, and you'll see that when I kind of dive into the system. So with that in mind, the solutions that we've done. So I was chatting to my colleagues earlier about this, and we were saying about a lot of this is that, for you end users, there shouldn't be much of a change. This should be easy, we've obviously changed the templates, which you might have seen as well, and I'll go into some detail when we look at that. But we've done a lot of work in the background to make it easier for you. So I'm loath to say, oh, it's really simple, because we've done a lot of kind of the hard work in the background. But for you guys at the kind of the front end, a lot of this should be familiar, similar, familiar and easy to use. So we're kind of going on this kind of familiar kind of process. So we've got, and I'll dive into the system in a minute, but we've got reports to help you plan. So, what are your cohorts for these vaccinations? How many patients would be falling into these? So you can make sure that you've got the appropriate appointments available. Are there any things that we need to consider before we send invites out? Because these patients might actually not need an invite. So we've built all of that into kind of that plan section, and I'll show you the reports for that in a minute. So we have that plan, and that's mainly kind of more for management, admin staff who are kind of, planning these kind of clinics for their vaccinations. So the resources and reports around that I'll show you. Obviously as well, we've got the notify section. So this is kind of like your invites. So sending out your invites and using the reports to send the invites out. So again, I will show you those reports, and they're very easy to use, and you can identify who you actually need to invite in and use the reports to do so. We'll then look at delivering this, so actually administering those vaccinations. So a lot of this is on the new adult and childhood vaccination templates. Now I say they're new because we've kind of condensed it into one easy to use template. The process is pretty much the same as what you've already done, but the templates are just kind of hopefully easier and everything's in one place. But again, I will go through those resources for you. So we'll look at that. And then at the end, just what reports are available to see how many have we given. And I'll also at the end just give you a quick overview of how this looks in Ardens Manager as well, and how you could maybe use that to look at, how you've done across the RSV or the COVID, how many have we given, and diving into the detail and a bit more, a bit more insight into that. So that's how we're going to look at this. And as you know, we've built templates for this, and we've built all those reports, and we've got the dashboards. So that's kind of the resources we've done. So with that in mind, I'm going to dive into the system and actually start showing you these. So I think I'll start on RSV, and I'll go for the RSV ones, then I'll do COVID, and you'll see how similar they are with regards to actually this process. So if I just come out of my slides, and I'm just going to go to my system one. So the first thing I'm going to do is I'm going to go to the reports. So again, you're probably familiar with this screen. So we're going to go up to reporting at the top in system one, and we're going to go to clinical reporting, and we're going to go to our normal reporting screen. You're probably using these reports already, so I don't want to kind of state the obvious. Now, as you know, on the left hand side here, where you've got my reports and local reports, you will have access to that Ardens Limited folder where all of the resources that we build live. So if we open that by clicking on the little arrow thing to the left, and then we've got A to Z. Now, the folder we want today is all the way down the bottom, and it's our vaccinations folder here. So we're going to open this one up, and then we've got all of things. Now, the annoying thing about SystmOne is we can only have so many subfolders, but I think you've probably used this already. We've just named them in a way, so it's in alphabetical order. So you can see you've got the C19 spring, all the resources for COVID, and then if I scroll down under R, we've got all of the RSV. So everything's in that folder. And as I say, we're looking at RSV and COVID. So I said I'd look at RSV first. So let's look at these. So all of the reports we want for RSV are in this folder here. So remember vaccinations, and then we start here with the RSV. And can you see how we've named these now? So it mirrors that kind of plan, notify, review, evaluate kind of stage, basically. So we're looking at the plan bit first. So planning ahead, what do we need to do? What do we need to check before we start inviting these patients in? So you're probably used to these. So the first two, we've got cohort and we've got due. So these are very, very simple. They're basically just showing you your cohort of patients that are eligible, in this case, for RSV. But the difference here, when we say cohorts, we've got all, but then we've basically then broken it down by, you've got your pregnancy, and then you've got your routines. So everyone over 75 and care home, or those two combined in the all. So it's all will literally be everyone at your practice that in theory may have or can have the RSV vaccine, but that's the distinction. So a cohort would be your total population, regardless of if they have had that vaccination or not. So you would not use that to say this is how many people need it, it's how many people have or haven't had it, but in theory can have it. So that's your cohort, and you can just run those to get an idea of the total number of patients that can or may have had it. That's different to the next subfolder, which is due. So due is looking at all of those that have not yet had it. So I think we used to use it used to be called eligible, so we've changed it to due. So whereas the cohort is the whole population, whether they've had it or not, due will get rid of everyone that has had it, and so we can see who we've got left. So we would be able to run those, and again, very similar. You've got due all, and then it's just broken down by those that are pregnant, routine, and then 75 and over in care home. Nice and simple, but in reality, if you look at the due ones, you'd be able to go, right, that's how many we've got left to get in at our practice. And run those, look at those patients, and you can kind of do what you want with them. It's not something you're going to have to run all the time, but there might be times where you just want to dive into that detail and look at those patients. So that's your cohort and your due. They're quite simple. We've also got, as part of the planning stage, some review before reports. Now in the RSV one, these are a bit easier. There's a few more in the COVID when I go through that one. But here we've basically got the idea of things you might want to look at before you send invites out for these patients to come in. And to be honest, a lot of these are just around kind of the pregnancy. So this is a really key one, the review before, check if still pregnant. So this is always a common theme within SystmOne, that sometimes how someone is coded as pregnant, it might pick up patients that aren't actually pregnant anymore because they've got some sort of historic code that the system thinks means they're pregnant. It's just the way it's kind of coded, or maybe they've given birth, but that's not being coded properly. Therefore, the system again still thinks that they're pregnant. So we always say, do run this one before you send your invites out, just to check that they are still pregnant before you send them an invite. It's very easy to run it and have a look, review those patients. There hopefully won't be lots in there, but check it before you send your invites out, and then just deal with it as appropriate. Obviously, some patients might have given birth or whatever, and that means you can just add the specific code and they will then come off that report. So again, nice and kind of simple. And then something I said at the start, so where it says pregnancy coded after last RSV invite, so you might have invited patients in previously who were pregnant and they had their RSV vaccine. If that pregnancy code has been added again since they were last invited, then you can check these patients, go, are they pregnant again? So are they eligible to have it again? Or is it just that it was added at another time? Do they need the RSV vaccine? And again, act as appropriate. So there's slight nuances. It's not something you'd have to run all the time, but useful to do some data checking just in case you've got patients that, oh, for some reason we've coded them as pregnant again, but they've given birth and they're not pregnant, therefore we don't now need to invite them in, or maybe we do, and you know, you can act as appropriate. So that's those two, fairly simple, but good to know that they exist. And that's kind of the plan stage. We would then move on to notify. So notify is where you actually send out your invitations to the patients to say, please come in for your RSV vaccines. So you can use these to do that. Now, again, you'll see what's changed from last year. We've kind of changed these slightly. So we separated out the pregnancy and the routines, and we've also got visits. So we've got 3 separate subfolders for these. So I'll do it in order. So I'll start on the pregnancy. These reports are basically taking those kind of due reports, the patients that are pregnant, and as long as you've reviewed them and you're happy that everyone on that list can have it, you can then dive into these. And if you notice, look, we've got, if I just highlight those, all of the ones I've got highlighted there are your first invites. Then we've got our second invites, and then third invites. Now, the way these are divided up, we've just done this to kind of make it easier for you as practices to, in theory, bulk send an invitation. So what you'll notice is there's all of those, but essentially the top one, that one there, is every single patient at your practice who is pregnant and are due the RSV vaccine. Now, that's all very well. You could use that report to invite them in, but what we've done is we've just divided them up just to make it easier to see if are there any. And again, if you're used to our long-term condition process or the flus that are from before, you might be used to this process. But what this is basically doing is it's looking at certain, I guess, nuances that you might need to consider before you just bulk invite them. So, for example, the consider method as under 16 would be anyone under 16, in this case, who are pregnant, that you need to invite in for an RSV vaccine. Now, the reason it's saying that is, what phone number do you have? Who are you actually, you know, do you want to send them a direct invite? Do you want to send their carer, their mum, their dad, however? So again, it's the same case across the board. Review those patients, decide how you would actually invite them in rather than bulk send them an invite. So that's the whole point. We've separated those out. The next one, again, similar idea. They are pregnant and due their RSV vaccine, but they have one of the following. They either have a code of learning disability, dementia, an SMI, end of life, or some sort of reasonable adjustment coded. And again, the idea there is you might want to review those patients before you invite them, because you might think, well, actually, I can't send them a normal invite because they might not be able to read very well, or they might not understand why I'm inviting them in. So again, you know, every patient's different, but we separated them out so you can go, actually, oh, it's because those 5 patients, you know, they can't read, or they need an interpreter, or they, you know, because that's a reasonable adjustment, or, you know, I need to contact their partner or their carer. So again, review those patients and then invite them as necessary using however method that you want. Again, just allows you to review them before you just bulk send them something. They are all mutually exclusive of each other as well. So, you know, you're not going to have patients overlapping in these reports. Essentially, all the reports there, all of those patients add up to this top one, but we've just divided them out. So the next one, that is electronic/communications annex. This is in theory everyone else. So they won't be under 16 and they won't need some sort of reasonable adjustment or specific invite because of having a learning disability. They will literally be, and I always say this, but for want of a better word, they are like your normal patients. So you can just send them a normal invite. And so in theory, what you could do is you could use AccuRx to, you know, run that report, look at those patients, export it out. If you've got AccuRx, just put it in there. You could send them all a bulk text or an email or however you want to invite them to say, please come in for your RSV vaccine. Or you could use the communications annex within SystmOne. So one of the options on here is if I right click and go to actions, you do have the option of going use communications annex, and that would then bulk send them a message. And because the communications annex, what it does is it has the option of a tick box at the top to say use preferred contact method. And what these reports are looking at is it's using that preferred contact method within SystmOne. And essentially, if you see the report, if their preferred contact method is either SMS, email, AirMid, or set as unknown, then basically they're going to be in this report, and you can send them a text using the communications annex. Or, as I say, AccuRx, however you want to do it as your practice. Everyone works differently, but as theory, that's the bulk of your patients. Please come in. I think the good things about these is because it's RSV, you're not going to have loads of patients on there anyway, especially with the pro, but again, it just allows you to manage it and do it quickly. I know I've spoken about the invite code. I will talk about that in a minute, but I just want to explain what the reports do first, and then I'll explain that bit. So the next one is a letter. So this is looking at patients that have a preferred contact method of letter. Now, a little caveat here is it depends at your practice if you've actually done any work around using the preferred contact method. And it might be that these patients have a mobile number, but they have said they would rather have a letter. Now, again, it is not for us to say how you invite them in. I know some practices would go with they've got a mobile number, I'm still going to text them. So that is fine. You follow your local processes at your practices. It's not for us to tell you how to do this. We have literally just divided those guys out, and anyone on there is pregnant, eligible to have RSV, but they have said their preferred contact method is letter. So you could call them, you could still text them if you think it's practice policy, you could, do what you want, but we've divided them out and then invite them how you want to invite them. And then the last one is no communication. I can't imagine you have many patients on this, if any at all, but if they have set their preferred contact method to be no communication, they will fall onto this report. And again, what you do with those patients is up to you. But all we're doing is saying they're eligible to have RSV, but they have said they don't want to be contacted. So you would have to decide, do we still contact them? What do we do with these patients? And that would have to be practice policy. Again, we've just divided them out. But in theory, all of those would add up to that top pregnancy one. So, that's all of them, or we divide them up by that. Majority of the time, you're probably just going to be running the one and just sending them all a bulk text, but I just wanted to show you that's how we have divided them out to make it easier. Now, however you invite those patients using those reports, you then need to code the invite code. Now, we haven't put these on the reports, but these are on the support article, which I'm sure my colleagues will be able to share with you in the Q&A. You might know what these invite codes are anyway, but I'm just going to go. I've got my web browser open, so I'm on the RSV one here. So this is the RSV support article, and we have just got the on here so I think there's only two anyway. So you've got the letter or the SMS text message. So these are the SNOMED codes that I've got highlighted on my screen. You don't need to write these down now. These are all on the support article that we'll send you, and you might know what these are anyway. But if you add either of those codes, depending on how you invited them, our reports will look at that code. And so I'm just going to go back to SystmOne. As long as those are added, then in theory, what you're going to do is, let's just say I invite, every single patient on this report. I'll run it just to get an idea of numbers. And as long as that code is added to all of those patients, when you rerun that report the next day, that should say 0. And then after, I can't actually remember the timing now on this one. I don't, James or anyone, I can't remember because it doesn't say on there now, but it's usually after a couple of weeks, they'll drop onto the second invite if they have not had their thing. Go for it, James.
It's 2 weeks.
2 weeks. Thank you. Thought it was. Thank you, James. So 2 weeks after you've coded that invite code, if they have not come in and had their RSV vaccination, they will drop onto the second invite report. And then you can just follow up and send an invite again. So it works the same way. So it's that 2 week gap, but it will only do that if you code it. So let me just see how many patients I've got on that one, just so I give you an idea. So there you go. Look, so I've got 37 on this report here that can all have a text or an email. So if I text them all to say come in for your RSV vaccine and then coded all 37 with one of those invite codes, after 2 weeks, if they've not come in, they will just fall onto those second reports there, and you just do the same again and then code the invite again, and after another 2 weeks they'll drop onto the third invite. And it is as simple as that, he says. So invite code, 2 weeks later, invite code, 2 weeks later, invite code. I'm hoping that makes sense. I'll move on to the routine because that's just the pregnancy ones, but I'm hoping you've got the idea now because they all work the same way. So that's your pregnant ones. You've then got invites routine. It's exactly the same, but these are everyone else. These are your over 75s or your care home residents. So they've been put into these reports. Actually, sorry, it's not your care home residents, they're on visits. Sorry, these are all your over 75s. And as you can see here, it's exactly the same. Look, for first invite, routine, all, and then we've broken them down. I can't imagine you get anyone under 60 on there because it's 75 and over, but it's still there. But again, they're broken down the same way. I imagine the majority of them are going to be on this one, but you might get some on the consider method. Again, invite how you want, add the code, and it moves them on to second invite and third invite. And then we have got a follow-up invite as well. So obviously if they've still not come in after 3, you can then start chasing them up as well on using that one. But again, it's the same method. You probably don't need me to teach you to suck eggs. It's very simple. It's that invite and then the code, and all of our reports follow the same thing. So we've just divided them out. Your pregnants and your routines are just separate on those, but the process is the same. And then you've got your notified visits. So this is where your care home residents live. So anyone in a care home or are housebound that are eligible for RSV will fall onto these reports, and you can run these. There is no invite code or anything on there because you can't really invite them in. All you can do is basically just code them and, but you can get the list off and go and visit them or do what you want, but we've separated those out to help you invite them like so. So again, I'm hoping that makes sense. It's nice and simple. Run the report, invite, code, and they're all on that notify section. So with that in mind, I'm going to jump into the template now. So I'm going to go to my patient up here. Now, you've probably noticed we've updated the template, and we've now got one adult vaccination template and one child vaccination template. So to be honest, nothing else has really changed from your point of view of using it. The template's going to look different. So the back end, we've done a bit of changing to make it easier, but the actual process is very much similar. So any patient that is eligible to have RSV and also COVID, I know I've not gotten to COVID yet, but it also said on there, they will have the patient status alert on their front screen. So as you can see there, I've highlighted those, and we can see this patient is eligible for COVID and RSV. So they hopefully would have had an invite and they're now in to have their vaccination. So I'm now the clinician. So you'd see that on there, or under their name in the top right, I've also got the icons. So to be honest, if I hover over, look, consider RSV, so I can click on that icon or I can action it. Both of them do the same thing. They are going to open up the template, but it's going to take you to the page where you give that vaccine. I will show you another way of getting this template in a minute, but simple. Patients in, RSV. Oh, Nathan, you're here. I'm just going to action that or click on that icon. They do the same thing, and it's going to take me to the RSV page of the new adult vaccinations template. So I'll go through this bit and then I'll talk about the template as a whole in a minute. So as you can see, I've gone straight to the page. Now, it's just worth noting, if the patient was pregnant, it would take you to another page automatically on the pregnancy vaccination page. So I'll talk about that in a minute. So this one I'm doing is more routine rather than pregnant. And what it's going to do here is, on the page, you've basically just got all the codes. I mean, again, you don't, it's all there straightforward. So, we can say why they're having it. So is it because they're over 75, or is it because they live in a care home? If they're pregnant, you'd see a different screen. So we've got those two options there. You've also got a link to the green book to the right if you just want to look at the criteria and dive into all the reasoning behind it. If you really want to do that, you probably wouldn't have time when you're doing it, but the link's there. So there's that. So you've got those to code that, and then you've got the administer. So we've got the consent codes. Now, we do have a consent page on this adult vaccination template, and I'll talk about that in a minute. But at this point, if it doesn't already exist, if I click on the wording, you will be able to see on the right hand side if we've already got consent. So can you see there, this was ticked on the 2nd of Jan 2026. So someone has already coded to say that, the consent has been given by the patient for this procedure. So if it hasn't, and we are the clinician, and we it has to be, I think, the clinician at this point, you could tick that at that point if you haven't got the consent, but that allows you to check it and tick it if it's not been done. Are they fit for their immunisation? So, have we checked their allergies? No contraindications? All very straightforward. I've given them some advice on the RSV vaccination. There is a drop down just to say if it was given under a PSD. And you'll be able to see the PSD at the bottom here. And here it says give. And if I click this button, it will pre-fill the vaccination template. You don't need to do anything else. It will pull through your batch number, your expiry date, if you've set that up already. You don't really need to do anything. You should be familiar with this. It's all pre-filled. Double check it, check anything else, click OK, and it's going to record that vaccination. Nice and simple. You can't really go wrong. It's a really, really nice way of kind of doing it. At the bottom, there is the option on the drop down just to say if there was a reaction, or if they DNA'd, or if they were contraindicated or declined. So you've got those options at the bottom, and you've even got the refusals here. So there's a button to the right of that where it says refusal, and if you click that, that would actually just add a vaccination refusal, which is a bit of SystmOne functionality. This is not a template we've built, but that would add the vaccination. You can see actually they refused to do it, and that would then be coded onto and recorded on the notes as well. But it is as simple as that, giving it. Now, that was all done on the patient status alert. As you've seen, this new adult vaccinations template, we've got tabs because we've put all of the vaccinations in one place. So you can kind of, go. So if I scroll to the left slightly, there is the tab for COVID. Now I'm going to talk about COVID in a minute, but they're all on the same template. I'm going to come out of this template a second. If you didn't have the icon up there, or you just wanted to have this template to be accessed all the time, another way of doing it is add it to your F12 favorites list. So if I press the F12 key, then we've got our launcher. Now you'll notice I've already got the adult vaccinations on my thing, but if you haven't, if you search for here, if I type adult and click search, you'll notice, or you could type adult vaccinations. I'd probably adult's a bit too broad really. So if I just do adult vac, that would help, wouldn't it? Adult vac, there you go. And then it's brought up the adult vaccinations template. And then what you can do is you can click and drag that to the left-hand side and save it on your favorites. That favorites list is bespoke for you, so only you can see what you want on there. And if I double click on it now, it opens up the adult vaccinations template, but at the front screen. And then you've got links to all of the different pages on the left-hand side, including RSV. I think for those that are eligible and are due RSV, it's easy to use the patient status alert, but you can get to it this way as well. And the only other thing I wanted to say was on here, you've got the consent tab now. So at any point, you can gain consent from the patient. It does give you the guidance on here. And, so you've got the various kind of like, I guess, if they filled out a questionnaire around, just adult vaccinations in general, you've discussed all the side effects, the risk. It's almost having a GP or someone having a consultation with the patient and going, right, you're happy to have all these vaccinations. They could go through these options. And then you've got the drop down there of all the various different consent codes for the different types of vaccination or declined codes. And then you'll notice here you've got the separate COVID one here as well. So I know I won't talk about COVID yet, but you could tick that as well there. And then that could be done before they even come into their clinics. That page has been done for ease of use. As I say, things like that COVID code there will also be on the COVID page. So they are in both, but this is almost just like a front screen where you just record the consent and have that conversation with the patient. So that's something else that we've added to this template. And then just another thing as well that's worth noting is there's a tab to the right of that, which is your PSDs. So you can use this page to add PSDs for the various different vaccinations. So if I'm the prescriber and I need to add a PSD for a certain vaccination, I could go in here and on any of these, so the RSV one here, if I click the button, the little preset button to the right of that, it's got the free text note. So, I authorize this to be administered once by IM injection, etc. Click OK. So what that's going to do is that's going to add the PSD code with that text to the patient record, and then that would be able to be viewed on the RSV tab when they're given it. So again, it's just planning ahead. People can use this template before the patients come in, and you've got these 2 pages for that. So I'm hoping that makes sense. I'm just going to dive back into the reports, and I'll just see if there's any questions once I've done that. So if I go back to reporting, so just a couple other reports that you can run once you've given those. We've got this review after report, and this is all to do with adding the pregnancy code on the same day as the RSV vaccine. So I think there was an issue when like CQRS started reporting on the RSV vaccines that if the pregnancy code was not added at the same time the RSV vaccine was given, then I don't think it wasn't being extracted properly or something, so people weren't getting paid for it. So we've built it onto the template when you give the RSV vaccine that you have to tick the box to say that they're pregnant before you give it for the pregnant RSV vaccine eligible patients. But this review after report will basically allow you to run it, and then you can see any patients that have had the RSV vaccine who are pregnant where that pregnancy code might not have been added on the same day. So then you can retrospectively add the pregnancy code on the same day as the RSV vaccine was given to make sure you get paid for it, basically. So just run that. If there's anyone on it, review it, make sure the code's on there, and then you'll get paid for it. It is as simple as that. A lot of this is in the support article as well, so it will explain it on there if you're not exactly, if you just need to kind of go over it. And then the only other report on the RSVs, this is evaluate administration. This is literally just going to give you an example of how many have we given in the last 12 months, how many have we given in the last month. So look, administered all in the last 12 months, and then that's split between done elsewhere and done here. Same for last month, done elsewhere, done here, and any that have contraindicated or declined and refused in the last year. So very, very quick reports you can run just to get those stats. A lot of this can also be viewed in Ardens Manager, and I will talk about that at the end, but that just kind of wraps it up. You can have a look at kind of what's been done. I'm hoping that makes sense for RSV. I'm going to go on to COVID in a second. I don't know, guys, are there any questions that's worth highlighting or, yeah. Don't worry if there isn't, but anything you think is worth me noting?
The main one's around the gestational age for pregnancy. Unfortunately, there is no way for us to be able to report in the clinical system on someone's gestational age because how accurately recorded the first pregnancy code is or an estimated due date. It's not something that we can anchor or report on accurately. It's why the pregnancy is split out into a separate invite folder to the routine. And it will mean practice will have to assess, do they want to send the invite with a tailored letter to say, once you've reached your 28 weeks gestation, please book an appointment with us? Or do they want to assess each of the patients in that list and only invite those who have reached that 28 week of gestation? Unfortunately, there's no easy way to make it a one-stop shop for those invites.
Thanks, Jay. I completely forgot to mention that, so I'm glad you reminded me because I remember doing that last time. But yeah, totally right. Thanks, James. Yeah, so again, like James was saying, you could use the review before check if you're still pregnant, but to be honest, the problem with, as James says, that is going to pick up every single patient that's pregnant, whether it's 28 weeks gestation or not. So as James says, just check before you send those invites out, how far gone are they actually eligible, or because you don't want to invite someone who's 10 weeks or 12 weeks. So yeah, unfortunately, as James says, we can't separate those out, but just double check those patients before you send the invite to make sure they're still eligible because they're 28 weeks or more. Thank you, James. Good point. Cool. Okay, I will move on to COVID. To be honest, I'm hoping this all makes sense because it flows the same way. So if I scroll up in our vaccinations folder, you'll notice now we've got the C19 spring reports, and these are our spring COVID reports that you can run. Now, it flows the same way. So you've kind of got that plan section that you can look at first. So, plan your cohort. So again, these are your cohorts. Already talked about that at the start. But again, cohort is your whole population, whether they've had it or not, of everyone that can or may have had the COVID vaccine. We've got a normal one. We have split one into groups as well. So the groups one shows you, asylum seekers or ethnic minority or homeless or housebound. So just different approaches to the same thing, just a different way of breaking it down. So we give you that choice if you need to look at those. And then the Jews work exactly the same way, but these are people that have not yet had the COVID spring vaccine. Right now, the cohort and the Jew will probably be the same, but as you go through the year, the cohort will stay the same, but the Jew will hopefully go down and down and down until it's zero. It might not ever be zero, but that's the idea, So that would just give you an idea of who you've got left to vaccinate their COVID vaccine, but obviously not until the 13th of April. So very, very similar. And again, look, we've broken that into the groups as well if you just want to see it by group. So very, very easy. And then just like before, you've got the review before reports. There's a few more in this one, just stuff to consider. A lot of these should be straightforward, but they just allow you to look at patients where, well, hang on a sec, should we just check these before we send our invites? So again, things like they had an allergy or adverse reaction coded. Is that still the case? Or could we offer them the COVID vaccine? A lot of this will need clinical input by someone who knows, they're not just going to be quick decisions, but you just need someone to clinically review the record and go, actually, that patient can have it. Oh no, we better not give it. So just allows you to do that. We've even got ones here that reviewing the status because they might still, are they in a care home? Are they housebound or has that changed? So you can review those patients and, just various ones around adverse reactions in the past or those that, contraindicated, last season, is that still the case? Or did they declined or refused last season? Do we want to offer that to them again, or are they just going to refuse again? One that's quite good to know as well, though, is this bottom one. So these patients will not be in the cohort to have the COVID vaccine, but they have on their notes, it's recorded that they have been prescribed I can never say the word, immunosuppressed drugs have been issued 1 to 2 years ago by a hospital. So again, you might want to review those patients and go, are they still taking this medication? Are they immunosuppressed? Can we offer them the COVID jab? Again, that's quite a tricky one because there could be 1,000,001 reasons why, but at least it kind of goes, well, those 6 patients, you might just want to have a look at them because actually 2 of them probably could have it because they're still immunosuppressed. So again, just have a look at that. Why was the drug issued by the hospital? What for? Can we offer them that COVID vaccine? So again, just stuff to do before you send your invites. And then the notify section, you've got less on here. We've only got 1, and then we've got the visits. So it's a bit less than on the RSV, but it works the same way. So again, as you can see here, look, it says from the 13th of April onwards, it's split. I'm not going to go through those again because I'm hoping they make sense, but it's split the same way. So you've got everyone or divided up by those under 16, those that might have the learning disability, dementia, everyone else that can have a text, everyone that can have a letter, and then anyone that says no communication. But again, the idea is all of those on there haven't had the COVID vaccine yet. They are eligible to have it, and they've not had an invite. So you can use those and invite them in, and then again, code them. So don't forget the code. And again, the code is on the support article. So I think I've already got it up. Yep. So we've got a handy table. There's a lot of codes here. It picks up all of them. So, depending on what you've done. So there's like, telephone invitation or first telephone invitation. There's lots of different codes, but any of those codes will work on our invites. So you might already know what the code is. You might have a preset set for it. It will be the same code. You know, we haven't invented these. These are the standard invite codes. But as a little guide, it's on the support article. So as long as one of these codes is added and it's the appropriate code, you would add it to those patients that have had the invite, and it just moves them on to 2 weeks. There you go. After 2 weeks, if they have not had their COVID vaccine, they will drop onto the second invites. You can invite them again, and then another 2 weeks. If they've still not had it, they'll drop onto the third. And then again, at the very bottom there, you've got a separate report just for anyone, you know, send a further invite because they've had 3 invites and they've still not come in. So nice robust way of inviting them in, same as the RSV ones, so it should hopefully make sense. And again, just like before, we've got a separate subfolder for your visits, so all care and residents or housebound patients that are eligible to have COVID, look at those, let's go out and visit them and do whatever we need to do. So nice and simple, very, very similar. It's just the good thing about this, we're trying to make it as easy as possible for you guys to use this. And as you may have guessed already, I'm going to go back to my patient, and I kind of already covered this. They're going to have the patient status alert, but this time it's going to be the COVID one. So it's either going to be there, or it's going to be under their name in the top right, or if you've got the adult vaccination template on your F12, you can access it like that as well. So if I click on the icon for the COVID up there, or let's action this, then it's going to bring up the same template I showed you before, but it's going to take me to the COVID page. So it's really nice, it takes you straight to where you need to be on that template. Now, you'll notice we've actually got a protocol for this. I'm going to talk about that in a minute, so don't worry about that for now. But traditionally, you might use it on this page. Now, again, it's very similar to that RSV one. You've got the indication, so you know why are they having it? Is it because they're over 75? Is it because they're immunosuppressed? Or is it because they live in a care home? So again, you've got those tick boxes just to say, you know, the reasoning why. And then the administer. So again, I talked about it already. You've got that, you know, consent given for vaccine for seasonal COVID-19 vaccine under a VGD. So again, if I click on that, if it's already been added, I would be able to see it here. So if you remember, that's on that consent page as well. But if it hasn't been added at this point, you can just do it from there and be able to tick that. So that's to have the vaccine in general. The next one, consent given for the procedure. So this is the consent to actually have the procedure. So it's all very well saying, yeah, I'm happy to have the COVID vaccine, but when it comes to actually giving the procedure, they've got to consent to that as well. So it's 2 separate things, and that's this tick box here. And you'll notice there is a link to the consent page of the template there if you need to get to it, but we can tick it there. And then standard stuff, you know, are they fit for immunization? If we check their allergies, there's no contraindications. Yeah, I'm happy with that. You tick that. And then you'll notice, and I'm sure you've probably seen about the VGDs now, so we've incorporated that into the template. So we have got the option to say administered under a VGD. So we would be able to tick that. And then again, you've got your drop down for, you know, your PSD as well if you need it. But again, it's mainly the VGDs, and that's the tick box there for that. And then nice and easy, just give whichever one you're giving. You've got the 2 different versions here. Click on either one. And it's already not going to let me do it because I think this patient's but yeah, and then it will pop up with the recall vaccination dialog box, exactly the same as what you've already done. I don't think you need me to go through this bit because you do it all the time anyway. It's just having that link to do that there. So again, it just flows. It's exactly the same as the RSV one. We're trying to make it as simple as possible. You've got everything in one place. Record that vaccination. There are obviously, again, at the bottom, has it not been given? And you can record your refusals at the bottom as well if you need to. So I'm hoping that makes sense. Now, the only thing that's different is we've got this protocol. And I don't know if some of you might have remembered, we did one for flu as well. Now, there's kind of no point clicking it at this point because you're already in the template. But what you might want to do is, if you remember the name of this, it's COVID-19 administration protocol. You might want to add this to your F12 favorites list. Or you could add this as a button on your toolbar. But I'll show you it on my F12. So if I'm just going to cancel that. So if I go F12, so I've already added it here, but I'll make sure this is on the support article to show you exactly what you need to type in to find this. So please don't worry if you don't remember this exactly, just know it exists. So if I oh, actually, if I type COVID-19 in, there's quite a lot on the COVID-19, depending on what your system's done. But if I type COVID-19, you will have, I've got to find it now. Oh, I've done the wrong one. Let me do seasonal vaccinations. Seasonal vaccinations. Oh, it's because I've got protocols ticked, that's why. So make sure you got show protocols ticked, and you will see you've got one called seasonal vaccinations COVID-19, and it is called, I'll just have to make that a bit wider, administration. So this is the protocol you want, and you know it's a protocol because it's got those blue arrows to the right of it. So this here it is, seasonal vaccinations COVID-19 administration. As I say, I'll make sure the article has the instructions for this, and then I could drag that over to my favorites list. Alternatively, this could be added to your toolbar. I won't show you that now, but again, I'll make sure there's instructions on the support article, because some of you might not be able to amend your toolbar. It's quite a tricky thing to show because it gets locked down and things. But the idea is, if a patient's coming to have their COVID, you don't have to go to the template. If you double click on the protocol, it will basically pop up and it will tell you why they need it. And you can basically say what it is that you want. So I can choose one of these, or you can open the template, but it does it for you. So I can click that, and then it basically tells me, it tells me what to do. Do I, do they consent? Are they fit? Are they fit under, one of these things? Have they contraindicated, or do I just want to open the template? But I'm going to say they consent and they're fit for the immunization. That's just telling me they've already had it, and then it pops up with the record vaccination. So it basically takes you step by step, and you can administer that vaccine without having to go to the template. It kind of does all the coding for you. You just go click, 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 and it's given. It's recording all the same information, but it's just another way of approaching it if you did want to do it in that way. Again, I'm using a test patient, so it's a bit, but hopefully that kind of makes sense. So it's 6 of one, half dozen of the other. If you use the template, that's fine. If you want to use the protocol, it still does the same thing. It just might be an easier way of doing it because you can have a button that you click and it does it all for you. You just have to do a couple of clicks. So again, I hope that makes sense. But again, it just kind of records it in a nice way. So yeah, that's recording it. And if I just dive back into the reports, and then how am I doing for time? That's fine, I should be fine. So just back in the reports, very, very similar. You've got your evaluate and then administration. So we're kind of looking at what have we done. So very, very similar to what I showed you on the RSV. Back in the reports, so evaluate, administration, and we've just got all of the various reports, how many were given, how many were done elsewhere, done here, done by third party. You get the idea. It's just showing you all of that information, and also it breaks it down by cohort. So how many 75s and overs did we give? How many immunosuppressed people between 6 and 74 did we give? You get the idea. It's not rocket science. You run what you need, and you've got all of the different information, including everyone that had 3 invites and have not had it, everyone that contraindicated, everyone that refused it. So again, it just simple reports to get that data off and see how you're actually doing across the season. And we also have just some reports just to see how many invites have you actually sent in total. So we actually sent 2,000 invites this, or etc. So again, those reports are useful as well if you just want to know how many have you invited in so far. So again, just works quite nicely. So yeah, I'm hoping that makes sense. I'm just going to dive into Ardens Manager and just show you what a lot of that looks like in Ardens Manager with regards to kind of evaluating that. I'll be very quick, and then we'll wrap up and see if there's any questions. So for those of you that use Ardens Manager, if you log into your Ardens Manager, if you don't, we can provide you information about having a trial on Ardens Manager, etc. And I think we do separate webinars on Ardens Manager, so I'm not going to spend loads of time on this, but it's always worth knowing because you can dive into the resources a bit more. So I'm going to log into my Ardens Manager with my smart card. And yeah, that's going to happen because I had it open earlier, and then it's right. I'll log in with my smart card, and I just put my smart card in, and then once I log in with my smart card, I will be able to get to the dashboard for my practice and look at the data that's being extracted out automatically from SystmOne into Ardens Manager, which is obviously like our population health management tool where it's got all of that kind of information. So I'm going to get into my dashboard now. And it will have your name, etc. on here. This is obviously my little training environment. Now on the left-hand side, if I go to services and vaccinations, so I've just gone services, vaccinations, we've got a nice vaccinations dashboard where we can just look at some of this data. So it's very similar to the reports I was showing in SystmOne, but we can start diving into the data a bit more. So, COVID-19 at the top, and straight away I can see the activity. Now, these numbers are just dummy data, so please don't take these to heart, but you've got your activity, how many were given elsewhere, given here in the last 12 months, not given. So all of those reports I was showing you, how many first invites did we send? So we can see all of that. And, we can then start seeing our activity by the different risk groups. So, 34% of our immunosuppressed patients have had it, 58.9% of our over 75s have had it, and overall we're on 25.42. So you can start looking at those sorts of stats, and you can also drill in. So out of everything that was given here, if I click view, and again, this is just an overview. Please don't worry. We will do separate webinars on all of this. So I don't want to go into loads of nuances because we haven't got, but I just wanted to show you could do this. So you could start benchmarking across a PCN or an ICB if they've got those kind of agreements in place. But what you can do is in here, we could kind of see the list of patients that have had that vaccine. And we could use that, to dive into the data. But also on the side here, we could actually see which members of staff gave that vaccine. So who's done what? So we can start diving in here. So for some reason, some receptionists were given the vaccine. And if you click on the resource, it might all just say unknown, but it will tell you the name of the template that was used to give these vaccinations as well. So that should say Ardens adult vaccinations template. But there might be times when someone actually used the wrong one or something, so that might not be an Ardens one. So again, this resource, because it's all this data's been extracted out, it's going to show you that, and it's a really, really easy way of like benchmarking and diving into this data more. And that was the COVID dashboard. There is the RSV as well. Look, click on that one. Same information for RSV, and you can start diving in and seeing how many invites did we send, what did we do, but then really drilling into that data. We'll do separate webinars on that, but I just want to show you that this is possible to kind of view that on there as well. Right, I'm going to wrap it up. I don't know if there's any questions from the guys in the that have been manning the Q&A. Don't worry if not. Might not be. While you're looking at that, so just going forward, just additional training and support. So this PowerPoint will be sent out to you. There are links to the support articles on here as well, so you'll have access to all of those, which tell you the codes, and I'll put a thing in about adding that protocol to. So please don't worry, that will all be on there. So all of that's on there. Biggest thing, training is free. So if you want to book training for your practice, it doesn't even have to be about this. It can be about anything. Drop us an email at training@ardens.org.uk. Book in some training. We're happy to do that. And if you have any queries at all, there's our support email as well. So going forward, we've got loads of resources to help you with all of this. So, it's just dive in. And we've got stuff on our Ardens Academy. We've got loads of webinars, recorded webinars on our support pages. Loads and loads of support. And don't forget our Facebook group as well, Ardens SystmOne, because there's loads of kind of advice on there, and we always put stuff on there as well. So yeah, I'm hoping that made sense, but please let us know. We always welcome feedback as well with regards to the resources, or what's there available, because we always want these resources to work for you. So feel free to kind of scan that and provide any feedback that you have. I'll open it. If anyone's got any questions, I'll hang around for a bit. But I hope that made sense. Thanks for your time, and I'll speak to you all soon.